Welcome today to this webinar where we're talking about Greece as a world-class fertility destination. It's one of the preferred destinations for fertility treatments and fertility tourism in Europe. So it's interesting to talk about why is this the case and what attracts people to Greece to have fertility treatment. And today with us, we have Dr. Elias Tsakos from EmbryoClinic, who is an absolute expert in reproductive medicine, and he's going to clarify a lot of the questions we have been getting from people who are considering treatments in Greece. Welcome, Dr. Tsakos, today.
Oh, hello, Andrea. Hi, everyone. Thank you so much for tuning in and for listening. Thank you for the introduction. It's a huge pleasure for me to present my country and the situation in Greece as it has been and as it has been evolving over the last few months after the COVID epidemic.
Dr. Tsakos, you are an expert in this area. You have trained here in the UK and you have knowledge of the area of reproductive health worldwide. Tell me, why is Greece a world-class fertility destination? What makes it special?
Well, I will outline the reasons why, and that is quality. And with quality, I refer to safety, success, and experience of the patients. And of course, we can elaborate further later on. Number two is access. Greece is very accessible travel-wise, but also treatments are very accessible with regards to waiting lists and availability of potential treatments. Legislation is number three reason. We've always thought in Greece that we had a very liberal, very patient-centered legislation. And in my opinion, we have been. However, there's always room for improvement. And nowadays, there's a lot of talks amongst the fertility specialists of Greece and also the health authorities in order to improve the legislation even further. And of course, I can elaborate on this later on. Number four reason is cost. And cost is not just the actual cost of treatment, but it's the overall cost effectiveness. Because as we all realize, it's not a matter of a single treatment, IVF. It's a matter of a package of treatments, and every couple has to budget the cost of the treatment in order for this to be as cost effective as possible. And overall costs are linked with success, because you understand that for a specific budget, if you can squeeze in 2 or 3 attempts, then you have a much higher success overall than if you can only afford having just 1 or 2 goes. Number 5 is the egg donation advantage that we have here in Greece. And this is mainly through to the legislation, which allows anonymous egg donation, as it is the case in most of the European countries. And of course, I'm very happy to elaborate further down the line. Number 6 is the opportunity of patients to undergo a surrogacy, gestational surrogacy procedure, which is something that has been possible, has been legal and regulated for a few years now. And to my knowledge, Greece is the only country in Europe, in the European Union, in which surrogacy is legal and regulated. And of course, we can talk about it a little bit later on. It used to be only 6 reasons up until about 4 months ago. With the COVID pandemic, now we have the COVID safety, which is an extra bonus. This is an extra bonus given by our people of this country who managed to obey the authorities, that managed to tackle the epidemic in such an amazing way, which resulted now in the fact that Greece is one of the safest places in the world with regards to COVID safety. So this is an extra bonus now, an extra reason why Greece is world-class destination.
So you've mentioned several reasons why this is the perfect place for fertility treatment. Being quality, access, law and regulations, cost, egg donation, surrogacy, and now specific regulations around COVID-19. And I want to drill down on each one of these. And let's start with the quality and the success of fertility care in Greece. What can you tell me about it?
Sure. I mean, I have in my mind, I mean, obviously, as you mentioned, I mean, I've been around for about 30 years, and I've been privileged to have been able to work with some amazing people all over the world. I mean, following my first 10 years in the UK, now, although I'm based in Greece, I've been working very closely and collaborating with doctors and patients from more than 30 or even more countries. So this has been an amazing resource in order to identify the areas in which we should be focusing on. So quality, in my opinion, is a general term that includes three main areas, sub-areas, which include safety, success, and also experience. So safety first is the confidence that we have initially as medical professionals, but also the confidence that we convey to the patients that they're not going to be at risk, and they're not going to risk their physical, mental, or spiritual health. And of course, in order to have this confidence, we have to have the procedures in place in order to ensure that. In general, I'm not just talking about EmbryoClinic. In general, clinics in Greece are very safe. In general, most doctors and most scientific personnel are hugely experienced. May I add here that it's illegal, I mean, it's a legal obligation in Greece for consultants only to perform fertility care. So we're not allowed to use research fellows or associate specialists and all that. With all due respect to those grades of medical doctors, you know, the Greek authorities have regulated fertility at the highest standard. I mean, in Greece at the moment, it's easier to become a heart surgeon than become a fertility specialist, again, with all due respect to the heart surgeons. It's easier to become an oncologist, an oncology surgeon, than become a fertility specialist. Why? Because after qualifying your specialty, which in Greece varies between, it's usually a program of 5 years. So the next day, if you're a gynae-oncologist or if you're a surgical oncologist, you can operate cancer. If you're a fertility specialist in Greece, you need to train for an extra 2 years. And to my knowledge, after qualifying as a generalist. So in my opinion, this has had an amazing impact on the quality of doctors really dealing with fertility. And also the rest of the staff in a unit, the rest of the medical staff, by law, they need to be consultants. So a registrar or a research fellow is not possible to practice fertility care in Greece. Maybe this is an extra reason why the level of expertise of medical professionals in fertility in Greece is high, because of this inability to train as a fellow or as an associate specialist. Most of the consultants are practicing in Greece at the moment have trained abroad. And most of them in more places than one and so forth. So I think this is one of the reasons that we have very senior, very, very senior medical staff practicing. And of course, this improves quality and safety. Now, on top of that, in terms of quality, we have obligation in Greece. Every IVF unit is obliged to have some sort of ISO certification for the procedures. To my knowledge, this is not an obligation in most of the European countries. I don't know much about the US, but definitely in Europe, to my knowledge, most of the European Union countries do not have an obligation to have ISO standards. ISO is not, of course, a panacea. It's not, you know, it's not something huge, but it is something. And in my opinion, it's better than nothing because it helps you think differently. It helps you devise and put in place protocols that perhaps you haven't thought of before. And it helps audits. You know, we have annual audit in order to retain our ISO standardization and all that. And on top of the standard ISO, which is the 9001/2015, which is the procedures ISO, in the last couple of years now, we have the obligation of the second ISO standard. So we are obliged, all of IVF units of Greece, in order to get a license, we need the second ISO standard protocol, which is the 15224 ISO regulation. So, you know, if not anything, this is ensuring extra layers of quality and safety. Now, with safety, I would like to mention the country safety. I mean, we all know that Greece is a very welcoming country. It's a very safe country. Most of our patients have been to Greece from all over the world for holidays, so they have experienced that. As you probably know, we have the lowest crime rates in Europe and so forth, and people are generally very welcoming, especially to the strangers and the foreigners. In ancient Greece, we used to have a god supporting and protecting foreigners, and that was Zeus, who was actually the head of the 12 gods of Mount Olympus. So as a culture, like you do in Portugal, I know that very well, yes, because I have been to Portugal many times. You know, we do welcome all our visitors, and of course, medical visitors and medical travelers are even more protected than standard ones. And of course, another factor that affects quality is experience. Most of the IVF units in Greece, including our own, are medium-sized units. They're not large-sized units, which means that we have the luxury of being very individualized. And we have this luxury of knowing our patients one by one. I mean, being a medical director in EmbryoClinic doesn't put me out of daily caring for my patients, of daily interaction with my patients, of applying my consultations and egg collections, embryo transfers, and Skypes, and so forth. So because of our size, we have this amazing luxury, in my opinion, because it is a luxury as a director of the clinic to be a doctor as well. So I think that puts maybe an extra touch, not only in terms of outcomes, because we all know that outcomes are related to various factors, but also to the actual hands of the person performing. So this affects not only outcome, but also the overall experience of the patients who feel that they've had the best possible care.
I think those are very good points that you've raised, because when someone goes abroad, they are concerned with that quality. They are concerned whether they are in a system that is regulated, where doctors are knowledgeable. So it's good that we are clarifying to everyone who is listening that is a very safe and high quality place to have treatment. And in terms of accessibility, we know that a lot of people worldwide don't have access to fertility care, and Greece is very well positioned in terms of accessibility, and that's probably one of the reasons why so many people go from other countries to Greece to have treatment. Tell me a bit, what makes Greece so accessible in terms of fertility treatment?
Sure. I mean, you all know that Greece is a touristic destination. So I think we owe a lot to the touristic sector that who have made Greece very accessible. So, you know, there's flights, there's connections, there's promotion. So Greece is known everywhere for being a touristic destination. So for us, the medical sector, to have been able to build on that was fairly easy, because the foundations, the touristic destination foundations, had been laid centuries before us. So this, you know, accessibility is not only a matter of distance; it's only a matter of legislation, visas, and all that. I mean, to my knowledge, from all over the world, you know, getting a visa to visit Greece either as a tourist or as a medical tourist is very straightforward. And I can mention that we've had patients from the most amazing corners of the world. You know, of course, Canada, Australia, the US, Africa, Cote d'Ivoire was one of the really very, very remote areas that we had patients from. We were very fortunate to have been very successful first time round with patient from that country, and then the whole village basically jumped on a plane and visited us. And luckily, that most of them were successful also. So, you know, of course, the UK, Ireland, Wales, Scotland, you know, there's a lot of people from all over the world. I mean, the Scandinavian countries, Germany, of course, Italy is a main destination, Balkan countries and all that. So, yes, Greece is very, very accessible. But also another obstacle, as you know only too well with your activities in the fertility world, Andrea, over the last few years, is the accessibility to care. So it's not just a matter of geography. It's a matter of being able to be treated in a unit with regards to waiting lists and all that. So for various reasons, there's no waiting lists in Greece in most of the units, even for more complex treatments like egg donation or pre-genetic screening or diagnosis for specific indications and so forth. So that is again another reason why accessibility is, in my opinion, second to none. I did a Skype a couple of weeks ago, and somebody is driving through the borders on the 16th of June. They would be treated before the end of June. Just to give you an idea.
Okay. And how about the regulations in the legal framework in Greece when it comes to fertility treatment? Sure.
In Greece, we have been fortunate to have had some amazing people. It's the giants that kept us on the shoulders. The previous generation to mine, my generation and myself, we are now in the third generation of IVF specialists. We have been very fortunate that the first and the second generations in Greece have been world pioneers. Some of them came from the US, some of them came from trained in the US, some of them in Belgium, some of them in the UK. And they have built all the bridges with the society, firstly, because in order to perform IVF, you have to talk to the society. And of course, with the politicians and with the church. So we have been very fortunate that there was a lot of very constructive discussions many years ago, as early as 20 years ago. So the legislation was an agreement between all the various forces in our country, keeping the patients at the center. So I don't think there's any magic in our legislation. It's just a legislation that focuses on the patients. And at the time, it was the local patients, the Greek patients. There was no, in the early 2000s, there was no fertility tourism in those days. On the contrary, there was a lot of Greek patients going abroad for treatment, and mainly to England and the US. So the focus was the Greek population, where there was a thought that there was a huge decline of the population, and still is. As you probably know, demographics in Greece is pretty much terrible. It's probably the worst fertility rate in the European Union at the moment, with 1.3 factor. Fertility rate 1.3, which is one of the lowest in the European Union at the moment. So the patient was the focus of our legislation, which means that the law was designed in such a way that the patient was protected and, of course, empowered. However, there are some defects. There are some, 15, 20 years later, it is time for revisiting the legislation. And I have to reassure you that we are looking into that from all angles, fertility specialists, patient support groups, the government, health authorities, the church. And very soon, we hope, within 1 year, the plan was to have the new law, new legislation before the summer. But because of the situation now, this has been extended. But hopefully before the end of this year, we should have some amendments that may make it even more patient-friendly and would allow even more patients to have access to fertility care. Now, a very small example on how quickly and how quick the reflexes of the authorities are is the fact that because of the epidemic, the first thing that the authorities did was that they extended for an unspecified time period the legal age of 50 for the female for fertility treatment. They have extended it to as many months required for patients already on a journey to complete that journey. So actually at EmbryoClinic, even we had a couple of patients who were turning 50 very soon, and they canceled the treatment because of the pandemic, and now they're available to continue with their treatment, although they're just over 50. So this is just to show you of the quick reflexes.
And you've talked about the cost, and that's a big driver for people from the UK to get treatment in Greece, because treatments are really expensive here in the UK. but in Greece, you're able to get very good quality treatments and maybe fit more treatments into that budget that you have, like you mentioned before. Tell me a bit about that cost of treatment in Greece.
Sure. I mean, firstly, as everybody knows, that costs of services and costs of medical services or touristic services alike depends on the general standards of living. So, of course, it's very difficult to, there's a lot of algorithms, as we all know, that costs are related to the outgoings and to the overheads and whatever of every country and every unit. So, standards of living in the UK are generally higher, and of course, equally salaries are quite higher, and so forth. So there is an analogy, there is a symmetry in the situation in every country. Now, in Greece, standards of living are quite low in terms of costs. So, starting from house prices, they're probably half price compared to big cities of the UK, and maybe quarter of the price. And I'm comparing, a big city like Thessaloniki or Athens compared to London. House prices are maybe a quarter or even less compared to London. Equally, salaries are a quarter or half compared to London, if not less, and so forth. So there is an analogy. Bottom line is that because of the general low standards of living in terms of costs in Greece, I mean, accommodation is much less expensive in terms of hotels. I mean, you can find a 5-star hotel in my city in Thessaloniki for, maximum 90, 100 pounds, or a 3-star, a very decent 3-star for 40 or 30 pounds, or B&B for 25 or 30 pounds, just to give you an idea. So, of course, when we all, and I take the liberty to speak on behalf of most of the IVF units of Greece, and as I happen to be a board member of the Greek Fertility Specialists Association, so I would ask my colleagues to excuse me if I don't quote anything correctly, but in general, I think overall, most of the clinics, we try to be very sensible. So we try to keep our costs very low, and in line with the ability of our patients, who are mainly our local patients, to afford the treatment. And as you all know, Greece has just come out of a 10-year crisis, so that was an extra obligation for us as fertility specialists to allow our treatments to be accessible. So I think these are the main reasons why costs are so low. And of course, low cost doesn't mean low quality if it's compared with the overall standards of living. So how does the cost factor affect success? In my opinion, hugely. I mean, I did a lot of my training in Newcastle, which is in the northeast of England, and which is probably one of the poorest areas, perhaps, in the UK. And I've had some amazing patients who, when they found out the cost of treatment, they said, "Oh my God, now I have the chance to at least have one go. Otherwise, I thought IVF was too expensive for me." So I think that's one end, and of course the other end is a standard family, either working class or whatever, or scientific or middle class family, who have a certain budget. So for that certain budget, if you can squeeze in 2 or 3 cycles, of course you improve the success. So in my opinion, cost is very, very important in deciding where to go.
And I can see here that there is a question. Would you like to answer any questions now, or do you want to leave them to the end?
I would like, well, you're in charge, Andrea, so please decide.
Okay, so I will leave all the comments to the end. But you talked about egg donation, and we see that over the past few years, there's more and more people using egg donation as a route to build their families, mainly because as women, we are wanting to have children later in life, and there's a naturally age decline at quantity and quality. So egg donation became a natural possibility to grow our families. Is that one of the reasons why people choose Greece as well?
Absolutely is the answer. Egg donation has become more and more relevant in our societies, and mainly in the Western societies, in which, for various reasons, women postpone their fertility journeys or their fertility wishes. or they're building a family plan. So egg donation becomes more relevant as we get into the 2020, or it wasn't as relevant maybe in the year 2000, 20 years ago, when the average age or the mean age of female age of someone seeking fertility treatment was very near 30. Now that average age of a female seeking fertility treatment is very near 40, especially in Greece and especially in our clinic. Actually, our mean age is 38 plus at the moment. So of course, egg donation has become very relevant in the last 10 years. But also availability of egg donation is another huge issue. And of course, I would like maybe to dedicate another webinar at some stage to speak about egg donation itself, because I have quite a few strong views on that. Because I feel that we are probably failing our patients by not communicating enough about egg donation. I mean, for example, as you probably know, there are countries within Europe, I will not name them now, perhaps I can tease people to attend the next webinar, in which countries people are not even allowed to mention the egg donation word. Even across the Atlantic, it's not an obligation for a fertility specialist in the US to mention about the possibility of someone having egg donation elsewhere. Of course, they're obliged to answer questions, but it's not part of the counseling or consultation requirement to inform, for example, that if somebody cannot afford to pay $20,000 or $30,000 for egg donation in the US, they can do that for a quarter of the price or even less in Europe. So anyway, this is something that as I said, I have very strong views, because I feel that the societies, the patient associations, fertility specialists, governments, the media, we have to disseminate the information that egg donation should be an option for anyone, whether they live in Brazil, where egg donation is legal but not available, whether they live in Italy, where it is legal, it has been legal but not available, whether they live in the UK, where the waiting lists can be as long as 3 to 5 years, and so forth. But anyway, egg donation in Greece has been available, has been practiced for more than 10 years now for international patients. I think one of the reasons why it is so available and so successful is the fact that there is anonymity of the donor, and again, there's a huge discussion around that. Of course, there's pros and cons, but definitely one of the advantages of anonymity is the availability of donors. And I'm sure that most of UK doctors and specialists and patients alike, they have realized that one of the issues now with lack of availability of egg donation in the UK is the lack of availability of donors. Of course, the anonymity produces availability. Two big centers in Greece in terms of cities, Thessaloniki and Athens, they host huge university campuses with tens of thousands of students, so that allows a huge source of potential donors. And this is giving us the luxury, if you like, especially at EmbryoClinic, we're a medium-sized clinic, we have the luxury to choose the best donors. I mean, how do we do that? I mean, firstly, by accepting only egg donors under the age of 30. I mean, as we all know, the standard European regulation for egg donation is age of the egg donor after the age of 35. But as we all know, the quality of eggs and the potential success of egg donation is much higher if somebody is even under 30 years old. So overall, the combination of availability, the combination of cost, and the combination of quality of our donors is giving us with the potential and the possibility to treat with egg donation with the highest, the top possible success rates.
Now, in terms of another treatment, surrogacy, which is a treatment that is very dear to me, but as I can see in most European countries, they are not surrogacy friendly in terms that the process is too complex for patients to think that it's even accessible to them. And Greece is very well positioned in terms of surrogacy. So would you like to tell us a bit about surrogacy in Greece?
Absolutely, yes. I mean, firstly, I would like to thank you personally because we've had some amazing discussions with regards to this subject, for which you are very knowledgeable. And thank you so much for giving me all your insights in the various discussions we've had in the past. So yes, indeed. I mean, Greece is the only country within the European Union at the moment, within the European Economic Union, in which surrogacy is legal and regulated. It has been so for many years. However, it has only been made available to foreigners, to non-Greek citizens in the last few years. At the moment, it's the only option for anyone who is wishing to have surrogacy, gestational surrogacy services within European Union. Of course, there's other countries in the geographic area of Europe in which surrogacy is also available. Now, I'm not going to go into huge details, but surrogacy has two main aspects. One is the aspect of surrogacy itself in terms of procedure, treatment, and delivery. Of course, this in this Greece has a huge advantage because of all the previous reasons I mentioned that apply to general fertility care. However, the biggest advantage in this aspect, in the aspect before the birth of the child, I think the huge advantage, which is even bigger, even compared to the market leader, which is the US in the minds of most people, is the fact that the court order is issued before we embark on any treatment. So court order means that the legal parents are legal parents before even the conception is made. And of course, this is giving a huge confidence to the parents, a huge security to the parents before they embark on the procedure that the child will be theirs. Of course, this is giving a huge reassurance to us, to the treating physicians and to our teams, and a huge protection, if you like, to the unborn child, and also the carrier themselves. They feel that everything is in order as well, because of course, they are very important in this equation. So, in my opinion, this is second to none compared to, with the top destinations in the world, which are the US, the UK, and so forth. The fact that the court order, the legal parents are legal parents before they embark on the procedure. Now, the second huge advantage is that the exit process. I would not like to go into detail, but I'm sure that most of you, if not all of you, are aware of the fact that there's a lot of children at the moment in European countries outside the European Union that have been born through surrogacy, and they are stuck in those countries. The report says that at the moment there's 100 children born via surrogacy in a non-European country, unable to travel home because of the COVID situation. And the projection is that there's going to be another 900, so a total of 1,000 children before the end of the year. So the second huge aspect of the advantage of Greece is the exit procedure. So after the baby is born, if the baby is born within the European Union, if the baby is born in Greece, it's much easier to travel back to the UK, even after Brexit, or to Portugal or Spain or wherever within the European Union because of the free travel. But even outside the European Union, it's much easier to travel from Greece than from a non-European Union country. So in my opinion, these are the two main advantages. And I would double that by the fact that, as you probably know, I have to mention that most of deliveries in Greece, general deliveries, anyone who gets pregnant, I would say the majority, I don't have the exact figures at the moment. It used to be 90% before the crisis of children born in Greece are born in private maternity hospitals. That has been a mentality issue in Greece. I mean, of course, we have an amazing NHS in Greece that managed only too well now with the COVID situation. And the facility on the NHS for maternity is comparatively very, very good quality. However, traditionally, Greek mothers, they deliver privately. Maybe this has been reduced a little bit in the crisis, but still it is the majority. So the majority of births in Greece are taking place in private hospitals. Now, why am I mentioning this? Because of this need, the private maternity hospitals in Greece are amazing. So there's been a huge demand for building such hospitals and such services that would be of top quality, of course, because of the demand. And with regards to surrogacy, the delivery facilities, in my opinion, the hospital facility is an extra bonus and is an extra added factor that increases the security, the confidence, and of course, safety and quality for the parents.
Yeah, I definitely think that Greece, for all those reasons, is the perfect place for surrogacy intended parents. Definitely 100%. And I think I have here one question that has been on everyone's minds, which has to do with the coronavirus situation, because a lot of people had their treatment stopped or postponed because of coronavirus. And now that clinics are starting to open, there's still some travel restrictions to certain places. So tell me a bit about what is happening in Greece, and is it safe, a safe destination? Can people travel there?
Sure. We've been very, very fortunate to have some amazing people dealing with the virus situation. Of course, on top of that, I feel personally grateful, and we are grateful to the Greek people who obeyed and listened to the guidelines. That was totally unprecedented. I don't think anyone could predict the compliance that Greek people had to the authorities. They showed an amazing, amazing dedication and amazing belief in the authorities. And as a result, we suffered the lowest case and death toll, one of the lowest in the world. I mean, in terms of figures, we've had 180 deaths, so only 18 deaths per 1 million. And I'm afraid you all know that this is comparing to maybe 300 or 400 or 50, 500 deaths per million in other European countries. So we were probably 20 or 30 times safer than the rest of the European countries. So as a result of this, the authorities relaxed the measures and the lockdowns much earlier on than in other countries. So we've been out of the lockdown for nearly a month now. So, however, there's still very, very strict guidelines, very strict health guidelines. I mean, may I mention here that our health authorities, our fertility and embryology authorities, they have put in place much stricter guidelines compared to the ESHRE or to the ASRM guidelines. For example, any couple undergoing stimulation for IVF, we have an obligation, we have a serious suggestion, it's not an obligation, but it is a serious suggestion, we all know what that means, to have a COVID test before they embark on stimulation. And of course, in our unit, we do this by PCR, which at the moment seems to be the most reliable test. And then again, before a collection, we do another COVID test to ensure that nobody takes anesthetics without having been tested negative. You may realize how has this impacted on the safety and on the confidence of our patients, who not only do they know that they are safe to proceed with collection and pregnancy, but also they are confident that the facility is taking all the precautions in order to make sure that the facility is clear of COVID as well. And of course, the same applies with surgery. I mean, we have, as you know very well, but most of our viewers may not know, I mean, my team and I, we have a very big surgical responsibility. We perform a lot of surgery, a lot of gynae surgery, a lot of obstetrics, a lot of deliveries. Our team is probably one of the biggest around for this. And of course, there's a big workload. So no one is undergoing surgery without a COVID test. I mean, we had an emergency ectopic pregnancy yesterday, and we had to wait for the COVID PCR to come out negative before we put in the theater, just to give you an example. And also with emergency cases, they're put in a very specific location of the hospital in a quarantined area prior to to having the security of the PCR test that are negative and so forth. So there's a lot of very strict measures. Now, of course, now the government have decided to open up for tourists and, of course, fertility patients alike on the 15th of June. So the borders are opening. In the first list of countries, unfortunately, the UK is not included because it's considered to be high incidence at the moment. Equally, Ireland, sadly, is not included. So our Irish patients and UK patients, please be patient a little bit more. And equally, the US and Italy and France are not included. However, Serbia is included. As you probably know, we have a huge connection with Serbia. Montenegro, Albania, Bulgaria are included in the green list. However, we expect in the next 10 days to have this list enlarged. There's going to be new announcement because the government are taking measures and then they evaluate every week in order to implement some added measures depending on how the situation goes. So I'm hoping, I am sincerely hoping that Greece will open for UK and Ireland, hopefully from July onwards, and the US, of course.
Yes, brilliant. And Dr. Tsakos, I would like to, I was just checking here on Facebook and on our webinar chat, if we have any questions or comments for Dr. Tsakos. Now it's the time to type them in. And I can see here on Facebook, some people have been saying, good morning, wonderful team. And some people from Ireland saying hi to you. And then we have here David saying, you have built more than a fertility unit, you have built a fertility family like no other. Amazing staff, amazing service, and amazing care. You can't really get better comments than this and better feedback than this. And one of the questions I think we can look into is for these patients who are still not allowed to travel there, like you said, from UK and Ireland and France, is there any way that they can maybe continue their fertility journeys by having a Skype or an online consultation with you, maybe having some tests requested in the meantime so that when they are allowed to travel, they already have some sort of plan in place? Any practical things that they can do with your team in the meantime?
Sure. We have been here. I mean, all members of my team, we've been available, we've been around, we've been accessible 16 hours a day in the last few months. So absolutely is the answer. All our coordinators, Maria, Ellie, Nicoletta, all our doctors, Agapi, Electra, Katerina, we've been around. Dave Gibbon in the UK available, myself, and of course everybody else. So our advice is to keep in touch, stay healthy, firstly, stay motivated, and stay prepared. And of course, we feel it's our obligation to support that. It's our obligation to update you with data, with medical data, with protocols about COVID, and of course to keep you alerted into any news or any new guidelines. So absolutely is the answer. We are offering endless consultations. We started very early in the morning with people from across the Atlantic, and we go in very late for our European patients. So it is very important, even with for patients who are attending other clinics. Our advice is to stay in touch with the clinic. Stay on course. You need to stay on course because I think it's worth it. And of course, we need to evaluate all the feelings of our patients. We are getting some amazing feedback of the importance of support. And you know that only too well, Andrea Trigo, with the support you're offering through your services and platforms. I think it's the time where all the fertility practitioners, we get together, we address the need of our patients all over the world. We keep them motivated. We keep supporting them. We need some data. We need some official data. And as we discussed previously, we have some plans now in place in order to obtain some data that would be valuable. Firstly, for us to understand all the issues, implications, and concerns of our patients. And secondly, once we've understood all that, to be able to deliver services and support suited to our wonderful patients, to the wonderful fertility couples and singles all over the world who have been hit very badly by the epidemic.
And we have here a question about quarantine from arriving travelers. Is there a quarantine in place for people arriving from abroad or not?
Sure. If you're part of those 29 countries released, and anyone wishing to go on our website, they can find out which those countries are. No, there's no quarantine obligation. In general, the strategy of our authorities at the moment is to create a list of countries that are considered low incidence in order to allow them to come in. Of course, there's going to be some tests in place. So there will be some random testing. There's going to be a lot of triaging, a lot of questionnaires and so forth. The touristic industry have been heavily involved. I understand that they have very strict protocols, and from what I've seen, because we do collaborate with a number of hotels, they have protocols as strict as healthcare facilities. So, but no quarantine would be necessary. However, if somebody proves positive on COVID, then there will be specific guidelines in place in order to protect that person and in order to trace people who have been in contact with them.
And Dr. Tsakos, one last question for those who are listening to us, and this video, I understand the video will be available afterwards for other people who might have missed it. How can people find you online?
Well, I think the best way is to send an email to info@embryoclinic.eu, and then my team would pick it up and take it from there.
Okay, so if you have any questions about treatment in Greece, we've talked today about several reasons why Greece is a world-class destination. We talked about the quality, accessibility, laws and regulations, the cost, egg donation, surrogacy, and now the COVID-19 safety, which is one of the plus in Greece. Dr. Tsakos, thank you so much for joining us here today and answering all our questions about fertility treatment in Greece. And
thank you very much, Andrea.
And thank you all our participants here on the webinar in Zoom and also on Facebook for listening to us. If you have any other questions after the webinar, just feel free to send an email to info@embryoclinic.eu, and the team will be more than happy to support you during your fertility journey. Have a nice day, everyone.
Thank you very much. Have a nice weekend, everyone. Thank you.
Bye.
Stay safe.